Universal health coverage is a promise that has been given to the people of this country by the government. The government aims to achieve universal health coverage in the next 5 years.
So when you're talking about a country achieving universal health coverage, it's that everybody is in. Not those who pay, not those in the formal sector, not the poor only, not the vulnerable only, everybody. So the universality here is that everybody is in.
Universal health coverage is, if someone needs a healthcare service, they should be able to access it of good quality without getting into any financial problems.
One thing that the Health Act 2017 indicates is that level 1 to level 5 hospitals with different kind of naming, primary healthcare to, and so on, dispensaries, whatever language you're familiar with, are under counties, okay? And level 6 under the national government. But, as you know, level 5 hospitals are funded by the national government. Okay, so we're saying, well, the law is telling us what everyone is supposed to do. It's not always very clear.
For example, access to health. There are people, even in some slums, you go for 2 kilometers, you get a health center. But in some places, you go for 70 kilometers. So we need to really define some of these parameters well, so that we are able to serve the people correctly.
Lazima CRA ifanye actual costing. Ni fedha ngapi zinahitajika kuprovide maybe health services in Elgeyo Marakwet. Ukiangalia sahi labda kaunti zetu ni less than 1% kwa sababu ile costing ama hawakufanya actual costing kujua ni fedha ngapi zinahitajika kuweza kutoa huduma fulani. Na hiyo sana ndio tunaomba, lakini jambo la muhimu ni kwamba ile equitable share ambaye inatakikana ipelekwe kwa county iongezwe kutoka 26%. Najua kama Elgeyo Marakwet propose kwamba iende 50%, nimeona Uasin Gishu pia wana propose iende hiyo 50%, lakini at least iwe percentage ambayo inaweza wezesha counties waweze meet their daily operation costs.
I think a lot should be done. When you go to the hospitals, the dispensaries, the county dispensaries and the county health facilities, you find that mostly we lack medicine. Even the health workers there, they are not enough. You still find gap in the health department.
When you look at the health sector, yes, the county is actually putting much resources, especially in health. When you look at it very critically, you find that it has not really met its own standards, given the fact that the county is purchasing enough drugs. But people are being sent out to go and purchase drugs, you know, of which you find that that's another big challenge among the citizens.
Kama ni health, kama ni hosi unaenda utu, unaona hizo hospitali dogo za serikali. Pale hivi ukiingia unaandikwa dawa enda nje, laboratory za zingine unaambiwa enda nje. Sasa si watu tunaumia juu tufiki hiyo ligi ya 5 so.
Kwa sababu ukifika kama hospitali, ukiwa na hiyo NHIF, kuna some services unapewa na NHIF na kuna zingine wanakataa. For example, saa zingine ukitaka kwenda mambo ya macho ama meno, wana discriminate, wanasema NHIF haifanyi. So tulikuwa tunauliza kwa sababu hiyo NHIF tulikuwa tunaona kama inaweza saidia. Lakini ikifika wanakuambia services hii unaweza fanyiwa na hii haufanyiwi. Hiyo haitufurahisha kwa sababu ukiona hiyo 500 per month ni pesa mingi kwa common mwananchi. Hiyo pesa kutoa mtu atakuwa amechikakamua na shida zingine nyingi yenye ako nazo.
Our people, I don't know, they always wait up to when they are sick. That is the time they know that they require an insurance. Then they have been taking the insurance or when they want to go for like surgeries. Then immediately after that, when they stop contributing.
Goal of universal health coverage is what we call financial risk protection. That when you access a healthcare service, it should not interfere with your economic situation. So you shouldn't have to, for example, sell your assets. You shouldn't have to, for example, forego your food. You shouldn't have to, for example, forego paying school fees because you have to pay for healthcare services.
There is one thing of having an insurance, then when you are sick, you don't get medication. So ours is that when you'll be having a card, the insurance scheme, you can go to the nearest facility and get the service. So that is our challenge, and I think we are working on it.
Katika Elgeyo Marakwet County, nataka nishukuru county kwa sababu ukiangalia katika hospitali yetu saa hizi mambo ya cleanliness iko juu, mambo ya hata at least vile mnahudumiwa madaktari na watu wa county unaona wanashikana pamoja, kwa sababu ukiangalia saa hizi hatuko na machines. Wakati budget ilikuwa inafanywa ya 2015 na 2016, hiyo pesa vile ilitolewa ya kwenda mambo ya hospitali kama machines na whatever na ujenzi expansion, tuliona kuwa inafanyika kwa sababu ukiingia huko unarithika. Alafu mambo mengine yenye niliangalia hospitali kuwa kina mama wenye wanajifungua wanasaidika vizuri sana. Kwanza ni vile wanajifungua free.
In our dispensaries and health centers, we don't charge anything. So you come there, you are seen, you go home. We have started a very rigorous process of ensuring that our people register with NHIF. In this sense, what we are telling people is that if you have more than 20 mbusis, can you give out one mbuzi, which is around 6,000, for you to ensure that your family is cushioned with the cost? We have been having a lot of issues when it comes to medical bills, whereby every now it's around. But right now we have seen is that it is coming down.
And universal health coverage has a number of goals. So the first is access to healthcare services. And of course, there's quite a range of healthcare services. We've talked about it's not just about access to services in a hospital. It's really about access to the entire range of services that you need.
Suggestion we came up with is the government can raise revenues through betting. This would help to cover the UHC through NHIF. Another suggestion of earmarking, maybe through counties that have natural resources like Turkana.
Earmarking is a situation where taxes are collected and set aside for a specific purpose, as opposed to being left, flexible to be distributed to whatever needs in health and out of health. So one of the ways that was suggested to mobilize resources is to improve efficiencies, to reduce the wastage that happens within the health sector.
Under UHC, we need to define the benefit package and then allocate resources as per the benefit package, or progressively move towards getting to the benefit package. But at least we make the right steps to funding the benefit package, because then that will take us closer to UHC.
The first issue that should be considered is data for easy rationalization and to understand the number of population that is within the sub-counties of Nairobi.
If we want to achieve UHC, we have to focus on the primary health care. In a county whereby you are putting up, for example, a 4 billion referral facility, do you need a 4 billion referral facility when the primary health facilities don't have the Panadols?
And then collaborative approach, that is by counties. Our politicians, our leaders should move away from the party politics. We need to have independent minds. We need to separate work from politics so that we achieve this big agenda.
We need transparency between county government, national government, and the private sectors. We need to know who does what, so that we should avoid the repetition and the backlashing, when you have our priorities right. Then the third point was we identify the primary issue in the different counties that you have. You find like maybe in Turkana, there are more painkillers, and in Turkana they don't need painkillers. Maybe they need cancer medicine. So what are we supposed to do? Like you're supposed to focus more on the cancer medicine rather than giving the painkillers, right? And then the last point was to have meaningful public participation on the health budget.
Which to me means essentially, number one, accountability, making sure that the system is accountable to the final person who is the citizen in the streets and so on. And secondly, it's about making sure that community voice is considered in decision making, because we are making decisions that will affect citizens. So we cannot make decisions that will affect citizens and then we do not incorporate their values and their voice. So it's not just about expanding access to services. It's not just about expanding access to what we call financial risk protection. It's about doing it in an equitable and fair way. So that is an explicit goal of universal health coverage.